Looks like we're live. Thanks to everyone who's joining. We've got a Start Engine and Kevin O'Leary elevator pitch session for you. We have three founders. We'll start off with our first one. Thin Tran, the CEO of Vita Imaging, is going to talk about their non-invasive skincare detection technology. So Thin, I'll hand it off to you. 2 minutes to pitch, and then we'll jump into 3 minutes of Q&A with Kevin.
Yes. Hello, Kevin. Nice to meet you. Yes, my name is Thin Tran. I'm CEO of Vita Imaging, and we are a Silicon Valley company pioneering a new era in skin cancer detection. Our mission is very simple: how to detect skin cancer fast, accurate, and make it accessible to everyone. So right now, if you go to a dermatologist's office, what they do, to look at the lesion, suspicious lesion, they just use a magnifying glass and their training and their experience, and from that they determine if you have cancer or not. So, as a study has shown that even 40% of the expert in the thing disagree on the result because it's fairly subjective and really based on the experience of each doctor. What we want to do here at Vita Imaging, we want to change that. We have our skin detection use Raman spectroscopy, which is an optical technique that shine light, laser line, harmless laser line onto the lesion. And from there, each lesion will have a very unique spectra, chemical spectra. And from that, we can determine if the lesion is cancer or not. So it's a non-invasive technique, very, very accurate, and very objective. So there's no experience of a doctor doesn't come into play. And this is a very common technique used in pharmaceutical material science to detect chemical composition of different materials. They've been well used in the industry. And we're the first company that take that same technology and doing that into skin cancer detection for medical application. We have been working for the company is 6 years old. We've been working very close with FDA. We have assembled a big team, we do clinical study and so on. We took the technology, this technology was licensed from the University of British Columbia that has spent over 20 years of research and over $20 million to prototype this technology and prove it. We've licensed that technology exclusively, and now we apply for FDA for class 3 PMA clearance, which is the most stringent classification for FDA when it comes to medical device.
Great.
And we're very close.
There to the time. Let's jump into some Q&A with Kevin. Kevin, what's your initial reaction to the technology? Any questions you have?
So is the existing methodology to take a biopsy and send it into a lab to examine it?
Yeah, the current technology use a magnifying glass, look at the lesion, and then they suspect it's cancer. They will do a biopsy. But it turns out that about 80% of biopsy are unnecessary. So our goal here is to have a method that's totally subjective and minimize the need for an unnecessary biopsy.
So is a biopsy more accurate in the outcome, though?
Of course, the biopsy is the gold standard now in the industry. So of course, if you have biopsy, that's probably the most accurate. But there are a lot of needless, unnecessary biopsy that our system be able to. You don't need to go there if you don't need to, and there's no cutting of the skin or anything like that. It's non-invasive. It's take 1.5 seconds to detect, and tells you at 92% accuracy if you have cancer or not. And the most unique thing about technology, we can detect melanoma, which is a deadly form of cancer, and also other form of non-melanoma cancer as well, which has a much higher incidence than melanoma, and no other equipment or product on the market mostly are focused on detecting melanoma, but not non-melanoma type of cancer.
And what will the cost be?
The initial cost would be $50,000 for the whole system, and you can either buy it or lease the product. Yes.
And so it's going to go through an RFP process, I assume, with hospitals. You need adoption. Do you have plans for how you're going to get it adopted?
Yeah, we have actually. We will go first to all dermatologists. That's the first where the product will be dedicated for. But we are expanding the use of this to general doctor, general practitioner, and there will be a clinical study, more study needed for FDA to allow to expand the use of the machine. But currently, the machine is only be used by dermatologists.
Great.
You're,
Last question, Kevin, and then we'll jump into our next pitch.
sure. So give us a little description of the raise you're attempting on Start Engine. That's why you're here. You're raising a round right now, I assume?
Yeah, we're raising around. We raised about 200,000 so far with Start Engine. This is the second time we use Start Engine platform, and we hope to be able to raise a total of 4 million total on this round. Yeah.
Well,
Great.
Thank you.
Thank you for the time and the pitch.